Dr. Limongelli, are you doing any orthodontic work in your office?
No, I'm not. I do quite a bit in my office. We do a variety of procedures, but the orthodonture I leave to the specialists.
Okay. Nevertheless, can you shade a little bit of light on it? Because there are, there are things called, there's the normal braces, the metal braces, and people are very, kind of like, well, not afraid of them in terms of afraid, but in terms of ugly looking. Then there is apparently the clear braces, which is a lot better, and then there is now lately the Invisalign. Obviously a dentist like you is qualified to do the orthodontic work, even though it's commendable that you kind of like treat your patients so well that you give a certain work to somebody who does it often and all the time and is by doing so slightly more trained on it. But you get you have all the basics. So I would appreciate if you give us a few of those basic rundowns and let us know when again a mom should bring her children to make sure that the teeth get straightened out and to check those things and all that stuff. Do you mind?
Not at all. Probably the most beneficial time for the parents to bring their children to an orthodontist or to have their children's teeth evaluated for braces is when all of the baby teeth have fallen out. Most of the orthodontists usually start their treatment after the baby teeth have fallen out, because that way they know just about what all of the permanent teeth are going to look like, and they can institute their treatment. Of course, there are exceptions. If a child is a thumb sucker, it can create a devastating thing with the mouth, because the teeth actually start to grow around the thumb, and the teeth don't come together in the front anymore. The mouth starts to look, like a fish. It stays open like that. Appliances should be made for children that have that problem in order for them to overcome that habit. Other than severe malocclusion, usually the best time is when all the baby teeth have fallen out, to start with braces. And as you mentioned, there's different types of braces. There's Invisalign, which looks like a clear plastic bite wafer that goes over the teeth that helps to create pressure on different areas of the tooth that help to straighten them out over a period of time. There's conventional braces, which have bands on the back biting teeth, the molars and the bicuspids, and on the front teeth there are little brackets that are bonded directly onto the teeth, and wires are placed inside these brackets and go into the little tubes in the molars, and they're activated to help to bring the teeth back. There's also clear brackets that can be put on the face of the front teeth, so you don't really see the metal brackets anymore. You just see a little thin wire. But these are pretty much the most conventional appliances that are used.
Okay, all right. And have you noticed that orthodontic is a good way to straighten out adults' teeth instead of doing all kinds of cosmetic dentures and implants and pulling teeth and all that stuff? Have you found it to be a workable system?
Orthodontics can be done on adults. It's also done on adults. Let's say you have a situation where you lose a tooth and the front teeth have started to space and open up. The orthodontist can be used to close those spaces back, and then the patient can get either an implant or a bridge to replace the missing tooth, and then everything will be in its proper position again. So orthodontics can be used. Orthodontics can be used in conjunction with the prosthetics or the replacement of the missing tooth to achieve a near perfect result.
Wonderful. Now one last question here. So let's just say I'm an adult, or I'm a mom or a dad with a teenager. and I'm not quite sure whether he or she needs orthodontic work or even my own mouth, would it be okay to come to somebody like, let's say you, and, do my normal whatever work checkout, and at the same time say, hey, doc, am I due for an orthodontic? Am I a candidate for it? Am I this? Is that something you would nevertheless be well, designing and saying, yeah, you need this and you need that, and then so would basically a general practitioner and somebody like you be a good place to even find out whether ortho is the first place to go? So meaning I don't have to first go and find an orthodontic. I can find out from you that I need it and that it is good for me, and then go and be referred to one.
That's exactly right. Most general dentists should be the first stop for patients that are concerned about straightening their teeth out. And the general dentist can usually tell them whether they are a candidate for orthodontics or not. And if they are and they don't do it in their office, they can refer them to a specialist to have it done.
Well, thanks a lot, Dr. Limongelli. Thanks a lot.
You're welcome.